Welcome back to Your Eye on Health with Dr. Sudip Bose. Joins us every Wednesday to give us great health and medical tips here on the front page. Doctor, what are we talking about? With a lot of interesting things here.
Well, today is going to be an interesting one. I'm going to shrink both of us and shrink our audience. Shrink us
Honey, I
to
shrunk the audience.
microscopic size.
All right.
And I'm making us so small that we're going inside one of the blood vessels in our body, okay?
All right.
So we're inside this blood vessel. What do we see? So here's our blood vessel today. It's this tube. Our blood vessels are like tubes, and inside is where the blood flows. And what are we seeing? We're seeing blood flowing. And when that blood flows extremely hard, high blood pressure, the blood's forcing itself through too hard through the blood vessels, it's damaging the inside lining of the blood vessels. Okay? And then if you have high blood sugar, diabetes for example, that blood sugar is like pieces of glass. It's like sharp glass shards that's going through your blood vessels and also scraping the inside linings of your blood vessel.
Not good.
So what happens then? Your body wants to repair it. So in comes the contractors to do the repair work. And you can think of LDL cholesterol, which is your bad cholesterol, as a really bad contractor. They come with this putty, and they take it and they basically just start patching up those holes that the glass shard left and that the high blood pressure left. And all of a sudden, with that putty, what do we have, Robert?
Looks like there's a blocking going on in the arteries.
Right, you're blocking that. That's a plaque. And you need this to be open so your lungs, your brain, your heart can get blood flow. And so then what happens is there's also a good cholesterol. This is the good contractor. He's like a spatula. He comes and just kind of cleans that out a little bit. And the whole point here, Robert, is not a silly example, but to show you that this is going on inside our bodies as we speak, in our blood vessels microscopically. And most of us don't even know. We don't know what our blood pressure is. And if it's damaging our vessels. We don't even know what our blood sugar is and if it's scraping the inside lining. And our cholesterol, we don't know what it is.
So the message
is to go to your doctor and to go to your primary doctor and get these things checked. Because, you know, people think if you have diabetes, you're going to just maybe have some bad effects, not feel good. It's a slow, painful death to have diabetes. I mean, you go blind, your kidneys fail, your heart fails, and this is also preventable. You go to your doctor, you take a simple pill for blood pressure, you prevent a stroke, you take a simple pill for cholesterol, you keep your blood sugar under check, and you can prevent really bad things like heart attacks, strokes, and just blocked arteries from happening.
Because like you said, all this is going on without your knowledge until it gets bad enough that something serious does happen.
Right, because you can't feel it sometimes. If your blood pressure is slightly too high or your cholesterol is high, we can't feel it. We don't know unless you go to the doctor. And again, I'm going to reiterate, women are better at this than men, because men just... Women, you know, over the process, they have babies, they go to their gynecologist. Men, we went for our shots, and then you go when you fall off a ladder when you're 40-something years old. So just go to your doctor.
Get in there and get checked.
Keep those arteries healthy.
Sure. All right. Thanks so much, Dr. Bose. And if you have any questions at home you would like answered here on the front page, go ahead and submit them to the email there right on your screen. Doctor, thank you.
Thank you.
We'll be right back. Stay with us.